we have another Congresswoman that I greatly respect, Congressman Blackford from Tennessee. Also, you have some more facts. I mean, you live with it. I yield.
Well, and I thank the gentleman for yielding. And Dr. Rowe is exactly right. He was a physician practicing medicine or trying to practice medicine under the impact of TennCare. I was a legislator trying to figure out how to pay for this as a member of the Tennessee State Senate.
Wait a minute, the Democrats just said this is going to be really cheap. It's not going to be hard to pay for.
And that is one of the interesting things. You know, Tennessee's TennCare program was put in place in 1994 as the test case for public option, government-funded, government-delivered health care. The interesting thing now is the White House doesn't want to talk about it because it is an experiment that was not successful. It failed. Even our Democrat governor has said it has been a disaster. And that was in an AP article.
Reclaim my time. The governor of the state said it was a disaster in Tennessee.
Yes, and one of the things we need to realize is this. TennCare was put in place as an executive order program of the Office of the Governor. It was an 1115 waiver from CMS. The State House and the State Senate got the bill of paying for it. What happened after about 5 years of this program being in place, and you had consent decrees and court orders, and you had companies that were dropping insurance, 55% of the enrollees on the program were people that were not supposed to be there. They had previously had insurance. And you had a program that was insuring or covering, gold-plated program covering 25% of the state's residents. Then the cost starts to balloon. You see cost shifting taking place onto those that have private insurance. You see restricted access by doctors and hospitals because they're not being paid by the program because there's not enough money to go around. And the cost of the program go to the point that they are actually absorbing every single new revenue dollar that is coming into the state of Tennessee and ends up being 36% of the state's budget.
Would the gentlelady yield?
I will gladly yield.
I just want to make sure I understand this. So, our Democrat colleagues say the big issue here is cost. Costs are going up too fast. President said it's unsustainable. In Tennessee, they put in a government-run plan, got the government involved, substituted the private market, and costs did not go down?
Costs skyrocketed, and we saw the cost go up every single year. And as Dr. Rowe can tell you, having been a physician trying to handle this issue, every single year, the cost went up on the public option, the access was restricted, the quality of care was diminished, and those with private insurance saw their rates go up 10%, 15%, some companies even 100%.
What you're depicting, it sounds like to me, is one of those things they used to do. They charge people money. They'd get a railroad track with two huge steam locomotives. They'd charge them money and they'd run them into it. It was a classic train wreck. It sounds like basically what happened was the government engineered a train wreck in health insurance. Dr. Rowe, you are the doctor. You're a medical doctor. I assume you got into the doctoring business because you wanted to take care of people. What was it like to be there? I'd yield.
Well, one of the things that when I got to Congress here and I heard this, began to hear the plan I said, well, we've tried that already in the state of Tennessee. This is nothing new. It failed. And can you say failed? It was a disaster. And the governor ran in 2002, our Democratic governor, his platform was fixing TennCare. Fixing what 6-8 years later was a mess in the state of Tennessee. Now, there are good parts in this plan, as we pointed out, things we will agree on. And I do want to show the public one thing. I almost broke my printer in the office this afternoon. But this is the bill that came out this afternoon, just to give you an idea that we're going to talk about in the next couple of days.
I believe it's 1,100 pages long.
It's 1,100 pages. And
the discussion draft was 600 pages. This is 1,100 pages. And if they do what they did on cap and trade, it will explode on the day of the vote to what, 1,400 pages with the last minute 300-page amendment?
But this is where the devil are in the details right here.
Would the gentleman yield?
Yes.
It was interesting. After our last series of votes, I was walking into my office, and as I went into the Cannon House office building, there's a Democrat who is engaged in this process is on the
just
committee.
reclaim my time for a minute. I'd like to introduce the gentleman because you're a medical doctor also.
That's
You
correct.
got in the business to practice medicine. You're not from Tennessee, you're from Georgia. But Dr. Brown is a respected expert on the subject of health care because you've been doing it all your life. And I'm just thankful that we have you here, and I'd like you to continue commenting where we are because this is a very important discussion.
Well, thank you, Mr. Akin. But it was humorous to me, but actually sad to me, because this Democrat, she said to me that all they're going to do is cover those who are not insured with this public option and give them the opportunity to buy into this public option if they don't have insurance. And I told her, how are you going to keep companies from canceling the insurance and from people being shifted over? That's going to increase the cost of insurance for everybody else. And so you're going to see just a continual shifting. Isn't that, Dr. Rowe, or Ms. Blackburn, isn't that what y'all saw in Tennessee?
If the gentleman...
I yield, yes.
I thank you, and I'll give a brief answer to that, and then I know Dr. Rowe will also want to comment on it. And it's so wonderful that we can talk from the perspective of a state senator who was charged with holding that program accountable, even though it was set up without the permission of either the State House or the State Senate in the state of Tennessee. And Dr. Rowe was charged with keeping his oath and making certain that he was providing care to those that were in his care. But what we saw, again, was the cost shifting that was taking place, the cost of insurance to those in the private markets going through the roof. I have employers in my state Senate district and now in my congressional district who have seen over a 3-year period of time their health insurance costs go up 100%. We also saw delayed care, and as the gentleman from Arizona knows, delayed care might as well be denied care.
Would the
I do yield.
With the gentleman to yield just on that point, this, by the way, our colleagues are saying we ought to do a Canadian-style system, something that gets the government more involved. Well, we all know Canada has a single-payer system. Some of us believe that those on the other side of the aisle want to create exactly that, a single-payer system, but they just want to transition it to it. I think it's very important. You know, you said the right to access to care is not the right to care. Actually, that's exactly what the Supreme Court of Canada ruled about their single-payer system. Chief Justice, and this is on this chart next to me, which I thank the gentleman for allowing me to put up. Chief Justice Beverly McLaughlin of the Canadian Supreme Court said in an opinion, which was issued in 2005, access to a waiting list is not access to health care. In an opinion in which the Supreme Court of Canada ruled that you couldn't be forced to stay in their system. You had to be given the right to get outside of the government program and get the care you need. So access, to the point the little gentlelady was making, access to a waiting list is not access to health care.
Now, just reclaim my time a second. Now, this Supreme Court justice, she was no right-wing conservative.
She was no right-wing conservative.
I mean, by political standards in America, she'd be considered liberal. She's
a very liberal justice.
And yet she is saying that this socialized system
didn't work.
It doesn't work.
It doesn't work.
And access, just because you got insurance, doesn't do you any good. You can have a free C-section, but if you have to wait 12 months, it doesn't do you much good.
If you have to wait 12 months for a free C-section, it doesn't do you much good at all. I believe our colleague could comment on that more credibly than we could. I just want to make the point. We don't want this. We Republicans want a system that responds to patients. We want patient-centered care. We don't want to give Americans access to a government waiting list. We want to give them access to actual health care.